Chapter 2 is looking at physical and mental health and health care. And before we begin, I want to say that countries are often classified into different broad categories according to the economic status. We have what is known as high income countries, which is the developed countries. We have the middle income countries, which is considered to be the developing countries. And then, of course, we have the low income countries, which is the least developed countries. And these are the poorest countries of the world. Morbidity refers to illnesses, symptoms, and impairments they produce. Patterns of morbidity vary based on a country's development. In the less developed countries, it is infectious and parasitic diseases such as HIV, tuberculosis, and malaria, which are much more prevalent. And in developed countries, it's chronic diseases that are the major health threat. Life expectancy is the average number of years individuals born in a given year can expect to live. It is used to measure the health of a population. In 2007, Japan had the longest life expectancy of 83 years. And class, it's been a couple of years ago, but I heard on the news that in Japan, there were over 100,000 women that had or that was over 100 years of age, which I thought was pretty astounding. Mortality, this is simply defined as death. Worldwide, the leading cause of death is cardiovascular disease. Excuse me. This includes heart disease and strokes. In the United States, heart disease is the number one cause of death, then cancer, and then stroke for both men and women. According to the structural functional perspective, healthcare is a social institution that functions to maintain the well-being of social members and consequently of the social system as a whole. It is concerned with how changes in society affect our health and how health concerns may lead to social change. The conflict perspective focuses on how wealth, power, and the profit motive influence illness and health care. They do criticize the pharmaceutical and healthcare industry for placing profits above people. Symbolic interaction focuses on how meanings, definitions, and labels influence health, illness, and health care. And they also look at how meanings are learned through social interaction in the media. There is one concept that you do need to be familiar with, and that is medicalization. This is defining or labeling behaviors and conditions as medical problems. For example, class, we now view homosexuality as a genetic or genes, okay, that promote that. We also look at alcoholism as a sickness rather than a bad behavior. Thanks to Tiger Woods, we now have sexual addiction. So basically, we're just swapping one label for another. You're now sick rather than bad. Nearly 33 million people have HIV and AIDS, and most people don't know it. But class, the spread of AIDS or HIV is an urgent worldwide public health concern. HIV is transmitted through sexual intercourse, unclean needles from mother to fetus, blood transfusions, rarely breast milk, but worldwide, the most uncommon mode of transmission is heterosexual contact. Obesity is a major health problem throughout the industrialized world, and it is increasing in developing countries. The prevalence of obesity almost doubled among children and went from 11 to 18% among adolescents and 12% among adults over the last 20 years. 2/3 of adults are overweight or obese, and it is the second biggest cause of preventable deaths in the United States. Obesity will shorten the average life expectancy in the United States by 2 to 5 years over the next 50 years. Mental health, your textbook talks about what it means to be mentally healthy and how it varies across cultures. They discuss it as a hidden epidemic and the extent and impact of mental illness. As far as the causes of mental disorders, some mental illnesses are caused by genetic or neurological, pathological conditions. Most of them are caused by a combination of genetic, biological, and environmental factors. Looking at some social factors and lifestyle behaviors that are associated with health and illness. As far as poverty and health, poverty worldwide is associated with malnutrition, indoor air pollution, hazardous working conditions, a lack of access to medical care, unsafe water, sanitation. In the United States, low socioeconomic status is associated with poor health. And that is because poverty is associated with health risk behaviors such as smoking, a greater exposure to environmental health hazards, unequal access to and use of medical care, and higher levels of stress. And of course, mental health increases with poverty as well. One thing that I do want to say about smoking, it is considered to be the leading cause of the burden of disease. And of course, here we are talking about tobacco. And we all know that smoking is difficult to quit because it does contain a very addictive drug known as nicotine. Looking at education and health, education is the strongest single predictor of good health. Low levels of education are related to health risk behaviors such as smoking, once again, lack of parental care and greater likelihood of smoking during pregnancy, and a lack of information about health risks. Lower levels of education are associated with higher rates of health problems, largely because of the link between education and income. For example, class people are more likely to be uninsured. Gender and health, gender inequality does contribute to the lack of access to nutrition and health care for women and girls. The division of labor, sexual violence, domestic abuse all contribute significantly to the health problems of women around the world. One in 3 women have been beaten, coerced into sex, or abused in some way. In the United States today, women's life expectancy is about 80.4 years. It is greater than men's, which is at 75.4 years. And that's because men are more likely to work in dangerous jobs, smoke, use alcohol and drugs, and are less likely to seek medical care than women. Cultural beliefs about masculinity and manhood negatively impact men's health by encouraging risky behaviors and discouraging emotional expression. As far as women, they're more likely to report psychological distress than men are. And of course, there are biological factors which may also explain gender differences in mental health. However, evidence is inconclusive. Gender roles may certainly contribute. In the United States, racial and ethnic minorities are more likely than non-Hispanic whites to rate their health as fair or poor. There are minority health differences. For example, the obesity rates are highest among Black Americans. Infant mortality rates depend on strong networks of family and community support. Certainly, lifestyle variation contributes to health disparities. Prejudice and discrimination cause stress, and we can go on and on with examples of those as well.